And now, Deborah Kobylt live.
Hey, Kurt, thanks for that introduction. And yes, I'm Deborah Kobylt, reporting from yet a different spot in my home, this time in my kitchen. And joining us on the phone right now is Dr. Jennifer Lang. She is an OBGYN and also co-founder of Supplies Saves Lives. Thank you so much for being here, Doctor. Appreciate your time.
Oh, my pleasure, Deborah. Happy to talk to you.
Yeah, I'm excited because I found out about you through a friend of ours, Lanka Domberger, because I saw something she posted right on the air and on her Instagram, rather, about she was going around in her mega van collecting supplies, right, and with her daughter and delivering them to area hospitals. And she said, no, you've got to talk to the doctor because this is the brainchild of Dr. Jennifer Lang. So why don't you tell me a little bit about Supply Saves Lives? It's incredible what you've done in about a week, right?
Oh, well, I'm thrilled to talk about it. I cannot take credit for it being my brainchild at all. This is a collaborative, thing that's happening, as are many of the efforts that we're seeing across the country and around the world, where people are getting together saying, what do I have? What can I give? What is the need? And how can we get this fastest to where it needs to be? So the origin story of the group is basically a friend of mine who's actually Elena Christopoulos. She's the commissioner for the status of women for the city of Los Angeles.
She's phenomenal. She's so great.
Yes, she is. So, dear friend of mine, and she posted on her social media one day that the wife of the St. John's Emergency Department was ready to drive around and pick up N95 masks anywhere that she could find them. The doctors in her husband's emergency department needed them that night. And so I saw that. I then put that word out through my networks. Two of my friends were like, hey, I've got some masks. I've got about 10. I've got about 20. Got together. So that was Raina Kumra and Rob Kramer. And Rob drove over to Raina's house. Funny story. He was short on toilet paper. She lent him some toilet paper. She gave him the masks. And
look, life is always about the barter, isn't it?
Right? It is the barter. Volunteers are waiting outside, masks, gloves, tables, accepting donations. He drives up with these masks and everybody applauds. They are so thrilled to have the donations. And he was filled with this feeling like, oh my God, I mean, my couple little masks that I had in my house are so meaningful. We talked about that experience, what it means to give when there's a need, but also how many of us in Los Angeles who have been prepared for fire evacuations, we all have earthquake readiness bags, in our garages. How many of us have masks, gloves, sterile Santa wipes, things like this that we don't personally need, but the doctors and nurses on the front lines in hospitals desperately do. And so
it's actually amazing because you would think that they would have such a surplus, but we've been so inundated with this COVID-19 that who knew, that we would need so many supplies like this. Yeah. So go ahead. I love this story.
Yeah. Well, it's a good one because it just speaks to the organic kind of nature of how ideas come to pass. So we're brainstorming. Hey, wouldn't it be amazing if we had somebody with a van that could just drive through neighborhoods and collect these masks and take them straight to hospitals? I'm like, I know a friend with a lot of kids. She's got a really big truck.
One of those monster vans, right?
Right, the Sprinter. Yeah.
And you guys even covered it, right? With supplies.
Right. So we reached out. It was an immediate, yes, absolutely. Have the van. I'll drive. It was like full-hearted embracing immediately.
Right. I think her daughter is going with her. Right? You just got kids. She could pick
Addie
anytime, right?
Exactly. So that was kind of how it started, was just this very organic through word of mouth. And then we thought, wouldn't it be amazing if we could simplify this by getting a texting platform up where people could text the word masks to a number, a toll-free number, and it would direct them through a kind of decision tree analysis, assessing what supplies they have, where they're located, and we could provide a zero contact pickup and delivery same day, immediately to
Let
the
me
people that need them.
Yeah, let me shout out the number, although we will put it all in our social media too. It's 844-974-2444, and just text the word masks. Doesn't need to be upper or lower, but make sure it's plural, right? Now, but you can also donate anything else other than masks, right? Like, what are people taking? What do you need?
That's right. So really, if we just look at what is the problem right now, and it is that doctors and nurses who are seeing patients who are arriving at emergency departments who are sick, the doctors and nurses are lacking the basic equipment, which we call PPE, that stands for personal protective equipment, that they need to keep themselves safe from being exposed to this virus. And so, some of this problem is, you're right, lack of preparation. Some of it is actually a global shortage in the manufacturing of these specific masks. They're called N95 masks because they are respirators. They can filter out 95% of these particles. And part of it is that as we started as citizens hearing about this COVID-19 crisis, many people with great foresight and planning ordered these masks for their personal use. And unfortunately,
I did not have that foresight. I was left without the toilet paper, without the mask, without the wipes, nothing. I've had to be very resourceful. I'm cutting up old clothing for real, and I'm using it as a mask. I'm using it to wipe stuff down.
Well, and that's exactly what you should be doing.
And what you got to do. Yeah,
you do. And the efforts that we can make as citizens are different than the efforts that, we need our doctors and nurses who are encountering high level viral exposure. They're engaged in high risk exposure, like when they intubate, when they put the tube down the mouth to help somebody breathe, put them on a ventilator. All of those viral particles get aerosolized up directly into the face of the doctors and nurses that are doing this. So they need the proper protection. Regular citizens in their homes don't need these masks. And so what we're encouraging, bless you, is for people to...
Really, I'm okay, guys. Go ahead.
is for people to release their stores of these specialized masks, the N95s, something also called KN95s, very similar, and surgical masks that are made to be disposably worn by medical professionals. We're also collecting nitrile gloves and Sana wipes, antiseptic wipes. Those are the main equipment that doctors and nurses needed. There are other things like face shields, gowns, head covers, those kinds of things. Much less likely that normal citizens will have those kinds of equipment in their homes. The masks are crucial.
Are you telling me that are people ordering more of these supplies? Because that's a lot of stuff that you need. I mean, are you saying all of this is in people's homes for real?
So we know that there are thousands of masks that have been ordered and are in people's homes across the country. And while the manufacturers of these masks are ramping up production, which they're doing, and we're having other manufacturers who haven't been devoted to this are now starting to problem solve and troubleshoot and produce a PPE, protective equipment. But until we get to that point, it really is urgently necessary that everybody who has these masks at their homes get them to doctors and nurses who need them immediately. We're facing a crisis right now where instead of changing out this equipment per patient, a doctor or a nurse might be given one of these masks for their entire shift or asked to reuse this mask. And this is so unsafe. It was never intended to be used this way. The manufacturer themselves state that this is not a recommended use of their equipment. So we really need to do everything we can to get the masks that are in people's homes to the doctors and nurses who need them today.
So talk to me about how that works. So I'm going to text to that 844 number, and I'm going to put masks. And
Yes.
then you were also saying that you wanted to have an area in a neighborhood where a point person, and all of those supplies would go there, and the person driving that mega van would pick it up at that one spot. Like, it's very organized for a grassroots organization, right? Explain to me how it works from A to B.
Sure. So we're really lucky to have technology on our side for this global crisis, where we can organize and communicate with each other. We have had volunteers use apps like Nextdoor to just put out to the world, like, hey, I'm collecting, gloves, wipes, masks to be picked up and brought to our local healthcare providers. If you have anything, there's a box out by my mailbox. Please just drop it off and I'll make sure that it gets there. Then we're calling those hub volunteers. Okay. Then once we have a hub volunteer, we can give our volunteer drivers, a route where they're passing through these various hubs, picking up equipment. We've determined where there is urgent need. And we are trying to work in a model of local. We call it hyper local, where, you really want to support the doctors and nurses that are in your community, taking care of you and your family and your children. And so we are making sure that donations are being distributed locally. The other thing we're doing is making sure that just one step outside of that immediate neighborhood where perhaps donations aren't flowing as readily into hospitals. So some of these hospitals that are more under-resourced are in neighborhoods that might not have the same socioeconomic advantages. Those patients have urgent medical needs. Those doctors and nurses do not have the kind of donations flowing in. So we are providing the equipment to them. And so within the Los Angeles area, we've brought donations to Northridge Hospital, to All of You Medical Center, that's kind of a satellite of UCLA, to MLK Community Hospital in Compton. Some of the Kaisers have accepted donations. So, there really is urgent need everywhere. And then, what we found is because everybody in the country is now dealing with this urgent need, that volunteers are popping up all across the country, and we're working with them as well. We've also made contact with the national coalition that's called Get Us PPE, and they are looking at using our texting platform because it is, so easy and really lowers the barrier to donation. Somebody can just text a number. It's a lot easier than asking them to go to a website or to go to a post office and put their supplies in the mail. A lot of people are nervous about leaving their homes right now.
Yeah, I would not go to a post office. I have to tell you. I have stuff to mail to a couple of my kids who aren't here. They decided to, stay put, which was probably a good idea for them. And I don't even want to mail them a package from the post office. I'm guessing, of the postage, and I hope it gets there. So yes, I'm one of those people. But isn't technology wonderful in this case? I have found there are so many people, doctor, we want to help, we want to do something, and there's the Nextdoor app, as you said, right? And there's you just start texting one another. Somebody's got the big van, somebody's got a couple of extra of the big masks. It's amazing, right, how our community has come together. Outstanding.
It's truly beautiful. And the other thing that happens is so many of us, we're trapped in our homes. Our brains start spinning about the state of the world, our kids, their schooling. We're filled with anxiety. Number one, that's not helpful for our immune systems. But number two, it's not really, it's not giving us an outlet or making us feel like we are contributing to improving the situation. However, if you can do something small, like go through your earthquake or fire evacuation bag and find something useful and know that it's getting someplace where it's going to be needed, you're having an immediate, I believe, psychological benefit that you are being of service. And so I think that there's something really to that. And I want to encourage everybody to think about, what are the resources you have during this crisis, and how can you mobilize those resources to contribute.
I'm hopeful that people will continue these efforts, once we're behind this, or in front of it rather, because this has been a time, I think, of reflection, and people have, almost gone back to the way things were, where you have time, you think, you're talking to your neighbors, even though it's social media, and people are just doing whatever it is they can. I love it. I love the effort. So, what is your biggest need? You said earlier masks. What about hand sanitizer? Because there's such a shortage of that as well.
There is, and so people have donated huge, like, gallon jugs of hand sanitizer that they happen to have as well. So all of those things can be donated. What we are starting to do is accept homemade. You were talking about cutting up fabric for masks. So recently, the CDC has made this universal recommendation that all people wear a face covering when they go out in public. And, this is easier for some people than for others to do. So what we're doing is we're actually collecting do-it-yourself homemade masks that are meant not for medical professionals, but for ordinary civilians and citizens, and we're donating those to homeless shelters, to community organizations where people might have not have the resources to purchase masks themselves. And these are the masks that we do want everyone to wear when they go out in public.
Right.
So getting those mass produced and distributed is kind of our next pivot.
Right. Very important, because, you've got a lot of women's shelters, homeless shelters, and they have to stay in place. And one of the volunteers was telling me, you're right, it's the homeless shelters. They also need waters. They need juice boxes, right? Thermometers are still a need.
Yes. Just a couple days ago, Lanka made a trip to a shelter with just those items that we had also collected as donations.
Do you not love that people are, like Lanka, for example, getting their kids involved? I mean, first of all, they're home, right? So what a great community service project, right? Get your kids involved, whatever. I think it's beautiful. So what else can you tell us so that people will respond? Call the number. And would you suggest text that number first, go on Nextdoor first? What would they do?
Well, I think just do a survey of what you have in your home and think about, okay, what do I really need, and be honest about it, to protect my family. And we're not saying, put your family at risk by giving up your last little container of, your last Santa wipe or your last container of hand sanitizer. But if you are one of those people who bought 50 and 95 masks for you and your family, I will tell you, you don't need those masks. The doctors who are intubating patients need those masks. And you can be very safe and protected wearing the fabric mask when you go out in public, and practicing good hand hygiene with hand washing, and, taking all of the normal precautions that we need to take as everyday citizens. But if you can do a survey of your home, see what might I have that I could contribute. Text the number. It's going to ask you to input, where you are and what items you have. If you're interested in getting involved on a deeper level, you can reach out to us again through the same text number, and volunteer to be a hub or a center for your community, in which case we then help you to come up with some posts for your social media, for the Nextdoor app. Reach out to local organizations where people might have things that they want to release back to the world, and we can do that in a safe way.
And step out of the box a little bit. As you said, there are a lot of communities in way more need than others, so think ahead and think, I'm going to call this place and see if maybe they might have a need, whereas we're, close by on the west side of Los Angeles might be less of a need. So just think a little outside of the box. Doctor, tell me a little bit about you and your practice and how you became co-founder of Supplies Saves Lives, please.
Sure. Well, so I've had a bit of a non-traditional route through medicine. I'm an OBGYN and gynecologic oncologist, so women's cancer surgeon by training. But in 2014, I had co-founded an international medical organization setting up cervical cancer clinics around the world. And that work was really calling to my heart. I made the decision to close my traditional practice in LA and really devote my energy into scaling up that organization, which is still going strong in 9 countries around the world. So over 100 clinics now, proud to say. But what I really got to see through that international work is how people can mobilize when there are a few resources, how people can come together through communication, through community to support each other, and particularly through crisis. And conditions that I never thought I'd necessarily see in America, we're seeing in this crisis. So a lot of what I learned internationally, I feel like we are applying today. So that, and then in terms of this crisis, it really does break my heart when I see my friends and colleagues that I've trained with and worked with throughout my career struggling to provide the kind of care that they need to provide without the proper equipment.
Go ahead.
No,
moving
right.
forward, what do we need to do as a nation, or if you want to just keep it a little smaller, in our own communities to make sure when the next pandemic hits that we're ready for this? We've got to just have stockpiles, don't we?
Yeah, well, stockpiles, but I also think for me, the big message here is that we're all in this together.
Yeah.
Okay. We do not exist in these isolated bubbles behind, walls or gated communities. We don't exist that way. We are a global community. And if people are sick and they're not getting access to care, this is going to affect all of us. So yeah. I think that, true preparation is making sure that, it's not just about me and my family being healthy and well and getting medical care, but everybody getting that care.
Right, because everybody affects you as well. So it just comes full circle, just like you said.
Absolutely.
Whether it's in the next town or the next country. I firmly believe in that as well. Beautiful. Just beautiful. Anything else you want to tell everybody before I let you go, and give another shout out, of course, to 844-974-2444 masks. Please. Anything else you want to tell people, how they can get in touch with you, perhaps, if they have a story that they want to tell you, perhaps, and help?
Sure. Well, I'm happy to receive any emails, or through the text line is a great way to reach out to me. And I just want to encourage everybody to, again, think about what you have to offer the world during this crisis right now. What are your skill sets? Are you an artist? Are you a maker? Are you a healer? Are you a therapist? Can you, and think about what are the needs that we all have, and how can you give your offering to the world? And because we truly are all in this together, we all have gifts, we all have services that we can provide, and we really are going to need to come together to solve this global crisis.
Yeah, and let's just hope, as I said earlier, that we take this with us into the future, because I think this is a really important model. I really do. Doctor, thank you very much for joining us. Before I go, I need to give a shout out to the 2 folks that I had to sort of postpone to another day. Stacy Beeman over at Plyo Jam, and also Florence Romano. She was going to talk to us about, how to help with your kids at home while we're all at home, and how to help with schooling and all that. But we're going to have.
Oh, you better get her on. Yeah, don't delay that too long. I'm not actually.
She's coming on in 2 weeks, because you know what? By then, parents are going to have their hair and they're going to be really pulling it out, because kids aren't going back to school this school year. You know what I mean? So it's been a challenge. I know some parents that are just like, what, forget it, just whatever you want to do. But others that are taking an opportunity to perhaps get them involved in charitable work such as this. I think this is a great opportunity, to sort of combine that with curriculum. So I'll have both of those on a later date. And again, Dr. Jennifer Lang, 844-974-2444 masks. Thank you very, very much for taking the time. And Lanka, thank you very much for doing what you do. She's probably somewhere on the side of the road delivering supplies right now. Is she unbelievable?
She's unbelievable. So I just a massive message of gratitude to all the volunteers that have stepped up for this effort. I mean, they take my breath away with how devoted they are. And it's a beautiful thing.
It is, everybody. So please donate, give whatever you have, small or large, and make you feel good. So thank you, everybody, for joining Deborah Kobylt Live. It's a very important time in our lives, personally, globally. And just take a moment just to think about how you can contribute. Like we said, small or large, there's something you can do. You don't have a mask, just like the doctor said. Are you an artist? Is there something else you can contribute? Do you work with elderly? You know, there's always a way that you can help. So just think about that, really. And thank you, everybody, for joining us. You can find us on YouTube and Facebook, and also iHeartRadio, Apple Podcasts, Spotify, anywhere that you get your podcasts, listen or watch. You'll find us. So thanks for being here. Deborah Kobylt Live. Don't forget to text masks, 844-974-2444. We'll put that in our social media. Thank you, Doctor.
Thank you so much.
Okay, we'll see you next time, everybody. Bye-bye.